Atrial fibrillation is a disorder where the top chambers of the heart beat very irregularly and chaotically, and the bottom chambers try to keep up with it. Some people feel their atrial fibrillation, some people don't feel it at all. There's millions of people out there that have atrial fibrillation and don't know it. Whether you feel your atrial fibrillation or not, it still puts you at increased risk of having a stroke. The traditional treatment for it has been anticoagulation. The problem with anticoagulants is they do cause bleeds. Watchman could be an alternative for patients that aren't a candidate for long-term anticoagulation. Watchman is a device that plugs up the left atrial appendage, which is a outpouching of the left atrium, one of the chambers in the heart where clot typically forms. And if that clot were to dislodge, it could go to the brain and cause a stroke. The thought is if you can plug that up, then the clot can't form and can't get out to the rest of the heart and to the body. It is not an open heart surgery. We go in through the veins, across the septum, make a puncture in the septum using a needle and ultrasound in order to get across there, and we deploy the device into the left atrial appendage. Watchman is a porous structure, and eventually the body tissue will form around it, and that's what actually forms the seal around it. The procedure itself takes about an hour. They will stay with us overnight. It's all done with general anesthesia. They'll be walking after their bed rest is over. Typically we'll do about 4 hours of bed rest, and they'll be walking right away, eating right away, talking right away. They will stay with us overnight for observation and go home the next day. They will need to take a few weeks off of any heavy type exertion, and it's not the heart so much that we're worried about, it's more the legs where we access. After the procedure, we do another transesophageal echocardiogram, and we look and see if that seal has properly formed. And that's when we make the decision about whether or not we think it's safe to stop the blood thinner for the long term. Most people, we are able to stop the blood thinner, which is the intended goal of the procedure.